Mechanism of the normal labor. The head enters the brain through the transverse diameter and to the lesser extent through one of the oblique diameter. Position occipitolateral or the oblique occipito-anterior, left towards right. The principal movements are engagement, descent, flexion, internal rotation, crowning, extension, distribution, external rotation, expulsion of the trunk. For the summary of the mechanism of labor occipital lateral position, the diameter of the engagement is available transverse diameter of the inlet suboccipito-pneumatic 9.5 cm, suboccipito-frontal 10 cm. Descent engagement increasing flexion is to the internal rotation of the occiput anteriorly to the 2/8 of the circle, simultaneous rotation of the shoulder to 1/8 of the circle, crowning delivery of the head by the extension, restitution, external rotation, delivery of the shoulder and the trunk by the lateral flexion. Engagement engaging anterior posterior diameter of the head, either suboccipito-pneumatic 9.5 cm 3/4 in slight deflection, the suboccipito-frontal commonest 10 cm. Engaging transverse diameter by parietal 9.5 cm. In premigravity, engagement occurs in before the onset of labor. In multipary, engagement may occur in the late first stage with the rupture of the membrane. 1/5 of the head may be palpable per abdomen during the engagement of the head. Vertex will be at the level of the ischial spine during the engagement of the head. Asynstolism. During the lateral inclination of the head, it is either deflected anteriorly towards the symphysis pubis or posteriorly towards the sacrum promontory. Posterior synstylism or the posterior parietal presentation. Sagittal suture lies anteriorly. Posterior parietal bones become the leading presenting part, found in the premigravida because of the good uterine tone and the tight abdominal wall. Anterior parietal presentation or the anterior presentation. Sagittal suture lies more posteriorly. Parietal bone becomes leading presenting part, found in the multipary. Advantages. Cells lesser diameter. Subparietal 8.5 cm to cross the pelvic rim instead of the larger parietal diameter. Asynstolism is beneficial in the mechanism of the engagement of head. Marked and the persistent asynstolism is abnormal and indicates a cephalopelvic disproportion. Descent. Pronounced in the second stage. Completed with the expulsion of the fetus. Premigravida, no descent in the first stage. Multipary. Descent starts with the engagement. Factors facilitating the descent: uterine contraction and retraction, wearing down efforts, straightening of the ovoid, fetal especially after the rupture of the membrane. Flexion due to the resistance offered by the unfolding cervix, walls of the pelvis or by the pelvic floor. Reduces the internal rotation, reduces the shape and size of the plane of the advancing diameter of the head. Two-arm lever theory: when resistance is encountered, short arm condylosis to the occipital protuberance descends on the long term, condyles to the chin, ascends the resulting inflection of the head fulcrum represented by the occipito-allantoid joint of the head. Theories that explains the anterior rotation of the occiput. Hertz rule: fibrous backward and towards the midline during the each concentration. Head occiput in particular, in well flexed position, stretches the elevator ani, particularly that half which is in the relation to the occiput. After the contraction, elastic recoil of the levator ani occurs, bringing the occiput forward towards the midline. Process is repeated until the occiput is placed anteriorly. Pelvic shape: forward inclination of the side walls of the cavity, narrow spinous diameter and long anterior posterior diameter of the outlet, resulting in the putting long axis of the head to accommodate in the anterior posterior diameter of the outlet. Law of unequal flexibility. Silhilum Anvaya. Internal rotation is primarily due to the inequalities in flexibility of the component parts of the fetus. Occipital lateral position: anterior rotation by 2/8 of a circle of the occiput. Oblique anterior posterior rotation will be 1/8 of the circle forward, placing occiput behind the symphysis pubis. Vento posterior position: rotation is 3/8 of the circle. 45% external rotation, 90% internal rotation. Internal rotation of the head with the movement of the shoulder. Torsion of neck. Neck has to sustain a torsion of the 2/8 of a circle corresponding with the same degree of the anterior rotation of the occiput, with some amount of the simultaneous rotation of the shoulder in the same direction to the extent of 1/8 of a circle. Shoulders move to the occupy the left oblique diameter in the left occipital lateral position and right oblique diameter in the right occipital lateral position. Crowning. Stitching after vulval outlet without any recession of the head. Biparietal diameter even after the contraction is over called crowning of the head. Delivery of the head takes place by extension through the couple of force theory. Downward driving force and upward force, pelvic floor resistance, neutralize and remaining forward thrust helping in the extension. Restitution. Visible passive movement of the head due to the untwisting of the neck sustained. Rotating the head through 1/8 of the circle in the direction opposite to that of the internal rotation. Occiput points the maternal thighs. Maximum cervical dilation during the labor is 10 cm. During the active labor, cervical dilation per hour in the pelvic cavity is 1 cm per hour. External rotation. Movement of the rotation of the head visible externally due to the internal rotation of the shoulder. Shoulder AP diameter, occiput points, and maternal thighs. Flexion, extension, and internal rotation and descent are the cardinal movements of the head in the normal labor. Suboccipital frontal is the commonest diameter of the engagement. Engagement in the premigravida occurs at the beginning of labor. Engagement of the fetal head is when the widest part of the presenting part has occurred through the pelvic inlet. Engagement of the fetal head is with the reference to the biparietal diameter. The cardinal movements during the normal labor occur in order as the engagement, internal rotation, delivery of head, restitution, and the external rotation. 1/5 of the head may be palpable per abdomen during the engagement of the head. The vertex will be at the level of the ischial spine during the engagement of head. The biparietal diameter has passed through the pelvic inlet in engagement. The internal rotation in the ventro-posterior position is 3/8 of circle. Maximum cervical dilation during the labor is 10 cm. During the active labor, cervical dilation per hour in the premigravida is 1 cm per hour.